Hi, everybody. A very warm welcome to all of you to this webinar dedicated to a very important topic entitled How to Get Published, a Few Tips. This webinar is part of a new webinar series on scientific communication and academic activities launched by the International Academy for Clinical Hematology. And we're very excited launching this series of webinars to highlight the crucial role of scientific communication in other academic endeavors such as peer review, grant writing, research dissemination, social media presence, media skills, where we believe that in an era of rapid scientific advancement, the ability to effectively communicate research findings, collaborate with peers, and is crucial actually to drive innovation. So this is why I'm very pleased and honored sharing with you some personal, I would say, tips on academic publication. I'm Mohamad Mohty from the Sorbonne University and Saint Antoine Hospital in Paris, in France. And of course, you have joined now the ICH broadcasting live. So I think everybody in the audience is well aware about the first law of medicine, which is first, do no harm. And I believe everybody is focused on this. However, I'd like to emphasize that there is a second law in clinical and academic medicine. And whether we like it or not, this is about the publish or perish, I would say, law. And this is really crucial. So before even you start writing your manuscript, your abstract, because this is about publication, I would like to draw your attention that novelty is a crucial issue. And you have to ask yourself, have I done something new and interesting? If the answer is yes, actually, we rarely think about it in the academic word, but I believe you have to pay attention and maybe discuss within your institution with your colleagues whether the findings are patentable, because then you may wish to modulate the right time for disclosing these new findings. So, and usually in academia, we rarely pay attention to this issue of getting a patent for something new. And there's always some tension because we've been always educated and trained about sharing information, dissemination, very quick dissemination. But I think you may wish to pay some attention to the issue of patent, which of course is very common practice when it comes to research and development and when it comes to industry, pharmaceutical companies. But I think our institutions, universities, hospitals, research centers, cancer centers are paying more and more attention to this issue. So you need to get a sort of an answer where you think there's something new and interesting. You have to ask yourself if there's anything challenging in your work. is your work related directly to a current hot topic? And of course, have I provided solutions to some difficult problems, diagnosis, treatments? Well, if the answer is yes to everything, I can assure you guys, this is a great high-level, international, high impact factor manuscript. If there is a no here or there, then probably you have to be less ambitious and maybe go towards lower impact factor journal. So, assuming you have something interesting that you would like to share with your colleagues in a paper, in a manuscript, you need to decide on the type of manuscript you would like to write. Is it a full article, original article? Is it going to be a brief paper, rapid communication, short communication, letter to the editor? Many semantics, many wording exists there, but in general, rapid communications, short communications, brief reports, letters to the editors are usually of limited size. It's limited in length. And this is about early, quick disclosure of findings, whereas full articles are usually substantial, very complete, comprehensive materials and methods, and it's about a significant original research. You may wish to write a review paper or a perspective paper or an editorial, and this is usually upon invitation by the editor. You may propose, you may send a query and say, well, I would like to write something, and you can negotiate with the editor. The other important question, once you have decided to embark on writing manuscript and share it with the broader community, is to choose the journal or the congress, in case you're writing an abstract, for instance. And it may not be easy, especially these days, because there are more and more journals available. And the question is about whether the journal or the congress can reach the appropriate audience. So, for instance, if you are highly specialized and your topic is about stem cell transplantation, the question is whether this podium, the journal, the congress, is the appropriate place to share stem cell transplant findings and data. Then you have to look into the scope of the journal or the congress. There is always a sort of a balance between whether you would like to aim for a general hematology population versus highly specialized. And in our field, we do have some general hematology meetings versus more specialized meetings. Whether we like it or not, I think people pay attention to the journal impact factor. And we can criticize, there are, I would say, pro and cons for the impact factor. But in general, people have a tendency to favor the high impact factor. Although I must confess that some great major papers were originally published in low impact factor journals, because sometimes it takes time to figure out the importance of the findings. And this is why things become more and more important with time, whereas some high impact factor publications actually may end up having little impact in the field. I think you have to look into the literature, whether there are articles of a similar standard to your own. I also recommend to look into the submission process because it's becoming more and more complicated. The softwares are very complicated, complex. So this is an important parameter in my opinion. How quickly will you receive the decision? Because assuming for whatever promotion, whatever thesis you would like to defend, if you would like your paper to be published quickly, well, you have to look into some of these statistics for a given journal about how quickly you will receive a decision or your paper will be published. More and more journals are offering the open access option, but then it has a cost. So you have to figure out who is going to pay for this if you would like to go for this option. And now there are journals which are fully open access. So you have no choice. You have to pay. So you have to decide. You have to figure this out in your decision process. There's always, as I mentioned, for the reviews and the perspective articles, the editorials, there's always a possibility to do a pre-submission inquiry to ask the editor whether your paper is suitable before completing the submission process. I am a little bit hesitant in between because in general, unless there is something very specific or very special, majority of editors will say, well, maybe, well, you can submit and we'll figure it out. The board, the reviewers will assess it, but that's an important option. So I'll jump in now to some common reasons for articles or abstract which are rejected. Why are they rejected? Well, sometimes you may have a great work, but actually simply you don't fit with the scope of the journal. If maybe it's very silly as an example, but if the journal is dedicated exclusively to lymphoma and you're submitting about myeloma, well, you're going to be rejected. Sometimes journals do not accept case reports, and this is written in the instructions to authors. And then if you submit this, may be rejected. I think key parameter, key reason for rejection is about these articles which are too parochial. They don't appeal to a wider international audience. They are maybe very important to you, and I'm not trying to minimize your efforts, but actually they don't appeal to the broader community. And this is important. You also need to bear in mind that a journal article is not a thesis chapter. Then you have the lack of novelty. Assuming you have started, for instance, a new transplant program in your center, and then you're very happy after 1 year, you have transplanted 100 patients and the outcome is great, and you'd like to share this with the audience. But if there's no novelty, your results are similar to what has been already published and known, what is already known in the field, then this may be problematic. It's a lack of novelty. Another important reason is about the flowed study design. And obviously here, you have to work on the methodology, and it means there's something that went wrong from the beginning, actually. Sometimes it's about a poor theoretical framework, the lack of the relevant references, citations. But more and more, what I can see is that in my experience over the last 25 years or so, being an editorial board member, associate editor in different journals, editor-in-chief in different journals, the manuscripts are usually poorly prepared. And they are written in poor English. And these are things where you can act upon. Maybe if in a randomized trial, the control arm is not considered at the end of the study as the most appropriate one, so the study design is questionable, you can't do anything about it. You have to live with it, and you have to provide the right arguments why it has been done like this. But actually, you can improve the manuscript, which is poorly prepared, and the English, I would say, style. On the other hand, your manuscript is going to be accepted because it provides an insight into an important issue. It is useful to people who make decisions. So ask yourself, what I'm publishing, is it useful? Is it going to be used by someone else to develop a framework or a theory? Does it stimulate new important questions? And did you use the methods, the right methods to explore the issue? And the methods are considered by the reviewers very rigorous, and there is a clear link between the results, the data, which are supported by the methodology, and they support the conclusions. Of course, your work is strong enough, it is connected to prior work in the field or from other fields, and at the end of the day, it tells a good story. Remember, we discussed in another webinar that delivering a nice lecture, a nice scientific talk, is about storytelling. Actually, delivering, publishing a good paper is also telling a good story. And in a good story, you're showing the readership something new. I have something new to show you. So let's work now together, guys, on how to prepare an article for submission, and of course, for a successful outcome at the end of the day. Well, I would recommend strongly that you read the instructions to authors. Pay attention to this, because different journals, congresses require papers to be in different formats. And I think it's an important step. You may think, well, that's not science, I don't care, but please follow the rules. Check the instructions carefully. Look at the word and figure limits. You have to write in a very precise and accurate manner. Check for the references. Check whether you need to provide supplemental data to allow the readership to better understand your methods, your population. Look into the language editing. Language editing is crucial, and I can assure you, a lot of great work or results can be immediately rejected because actually they are written in a poor manner, where obviously the reviewers, the referees, are not comfortable or are not able to capture the essence, the novelty of your data. So please don't hesitate to seek advice from colleagues, from friends. You need, of course, to prepare a cover letter for your submission. Now, let's go into some practical issues. How to format your article. The abstract. Pay attention to the number of words, usually 200, 250, depending on the journal. Do not overstate findings. Stick, please, to the facts. Provide specifics, not generalities, saying, oh, this is a great treatment, but avoid clogging the details. The introduction. Usually, from my experience, it's most of the time too long. It doesn't need to be too long. You need to tell your reader what you are going to tell them. On the other hand, the material and methods, the patient and methods, in my opinion, I have seen cases where it is often very poorly organized, superficial. Try to do things in a logical way. And usually, if you follow the logical steps of an experiment or the logical steps of managing a patient from diagnosis until post-treatment, actually, you will be successful. Don't forget the consent, the IRB, the origin of the reagent. Be careful with the statistical section. Involve experts. These are crucial parameters. The patient and methods, or the material and method, is crucial because people need to be able to reproduce, to understand how you ended up having such results. So very important to pay attention to the methodology. The results are frequently too short. Please avoid redundant tables and text. So if you have all the patient characteristics in a table, you don't need to write it all again in detail. The discussion, well, the biggest problem, usually many people are repeating the results. And that's not good. That's not good. That will weaken your paper. A discussion is about the interpretation of your results, of your findings. So you have to start with the most important and novel findings. You have to compare this to the literature. So you need to be knowledgeable about the literature. You have to go and look to the literature, read the other papers in the same topic. So, and of course, please don't forget the novelty. So if you keep on repeating, we confirmed, well, actually, at the end of the day, the reviewer will say, well, if you only confirm, then there's nothing novel. Everybody has done it before. I personally recommend to avoid using "to our knowledge." Well, because I believe everything should be to your knowledge. I mean, you can't write something that you don't know about. So then there are a few small details like, the significance trend, statistical trend, but this is not good because your trend can be towards being positive or it can be towards being negative. So just stick to the fact. Just don't overstate and overinterpret your data. So your manuscript is ready. You have to write a cover letter. I think you have to pay attention to the cover letter because remember, if a journal receives 1,000, 1,500, 2,000 new submissions per year, actually the cover letter is the only thing that the editor-in-chief will see or the associate editor. So you have to use it wisely to sell them your paper. You have to focus, to select, to state the major topic in your paper, but also emphasize importance and novelty. There are a few other details about the corresponding author, contact details. Don't hesitate to include reviewer suggestions. Although I must confess, sometimes, authors suggest reviewers, and they may not be the most friendly ones. That's at least from my experience as an editor. You may wish to exclude reviewers. And last but not least, please don't forget to include the financial statement and conflict of interest. Please pay attention to some ethical aspects, authorship. We are seeing more and more authorship disputes. Sometimes you have forgotten someone important who contributed to your work. So there are strict rules for authorship, who qualify and in what order, first, last, second, first three, equal contribution, who is the corresponding author. The funding received, don't forget about registration of clinical trial. And of course, you're only allowed to submit to one journal at a given time. If you're doing research and having images from the lab, image integrity is crucial. Now, there are sophisticated softwares which are able to detect any manipulation. So image integrity is crucial, but also plagiarism, Now there are softwares, so if you copy and paste a full paragraph from the discussion of another paper, it will not make it through the system. So don't think that the editors, the reviewers are not going to pay attention to these details. If you're using someone else's figure or table, well, there are some rules and ways to obtain permission to reproduce these items. So once your paper is submitted, actually, I would like to describe the peer review process for you. Your research is usually evaluated by the experts. Well, in general, the editor-in-chief, the associate editor, will decide whether your manuscript is within the scope of the journal. So again, if you are in a general hematology journal and your work is about using whatever cellular therapy in regenerative medicine for the brain, well, probably there will be a quick rejection because there's a problem of scope. And of course, the editor-in-chief, the associate editor, will look into the novelty and the quality. And if these criteria are not good, actually you will end up having a rapid rejection, which I think is always, you have to view it positively, because then it allows you to avoid waiting weeks or days and then submit to another journal. If the article is within the scope, it is sufficiently novel, of good quality, then the editor will ask for 2 or more reviewers to look into the manuscript. And based on the reviewer reports, the editor is going to make a decision. It could be immediate acceptance, which is very, very rare. Rejection, or usually, and this is the most frequent scenario, asking for major or minor revisions, and then the paper will be re-evaluated. And then you will receive a decision letter, and now more and more journals will send the same letter to all the co-authors in one email. So if you are in a scenario where you have to revise your manuscript, then you have to respond to the peer reviewers. And take it positively. Be positive and consider that this is an excellent opportunity to improve your manuscript. So you have to reply point by point to all comments. Even if it's only saying it's a good work, well, you can reply, thank you for the positive comment. It doesn't harm. If you don't agree with a comment, simply you can respond that you disagree with this comment, but explain why. Just be polite and explain your point. Because upon your resubmission, the paper will probably be sent for review again, and probably the same reviewers. And please remember, acceptance is never guaranteed until you receive the final decision from the editor stating that your paper has been accepted. After acceptance, it would go through the production department, copy editing, and the famous advanced online publication. Once you're published, then congratulations, you did a great job. There is this open access option, which is more and more frequently proposed. As I mentioned, some journals are exclusively open access, and you have to pay for this. So you have to take into account and secure the funding for this. Your institution may wish to have a press release, an alert. You may use social media to let people know. X, former Twitter, LinkedIn, Facebook, put it in your email signature. Actually, you can promote your paper. Now, if your paper is rejected, what to do? You can appeal the rejection. If you really feel that maybe the reviewers, the referees did not capture something, or there was some misunderstanding. That's not the most frequent scenario, because if you have, usually the rejection is based on negative comments from different reviewers. So it's unlikely that the appeal process will transform the decision, but sometimes it can happen. You can, if your appeal is accepted, then you can resubmit to the same journal. In general, if you're rejected, you are going to submit to a different journal. And my strong recommendation, take into account the comments and suggestions and revisions requested by the reviewers of the journal which has rejected your paper, because you may end up having the same reviewer. And I can tell you, it's very upsetting to see that if a reviewer recommended to you saying, oh, there's a typo error, page 10, line 12, and you didn't even dare, paid attention or correct it, they're going to be in a very bad mood. So I strongly recommend that you make whatever changes you can make and submit to a different journal. I don't recommend that you just forget and never submit it again. Now, related to the importance of preparing the manuscript, I think writing is crucial. Writing your manuscript is important. You have to get it right when writing. So, well, most of the journals, at least these days in the field of science and medicine, this is in English. Well, it's not a minor issue. You have to decide whether you write in UK or US English. And there are clear differences. And you need to have a homogeneous paper. You should avoid like mixing everything. Be careful, for instance, separation of decimals in English, it's a period, it's not a comma. Whereas separation of thousands and millions. So metrics, abbreviations. So there are rules, and the abbreviated units have no plural. Think about the space between the number and the unit. These are small details, but actually they give a good impression about your paper. So it is important to take this into account. You have to avoid proprietary names, the brands. You have to use the chemical names. Using the brands should be exceptional because it is needed, because, I don't know, you're comparing two brands in a given paper. We also see a lot of abbreviations, and this is an example here. Effect of graft source on MUD HCT after RIC in patient with MM. Well, you have to, I think, define these abbreviations. And usually, all abbreviations should be defined at the first mention of the word and thereafter used only as the abbreviations. And please don't forget that the abbreviations only count for a given section. They have to be given at first mention in the title, in the abstract, in the body of the paper, legend to figures, table, supplement. Also, words or expressions should only be abbreviated if they are used more than 3 times on that section. You have to avoid by all means the use of colloquial, non-scientific words or expressions. Well, you may discuss with your friends, say, oh, the cells were put in the tube. Actually, cells are placed in a tube. The assessment gave a result. The assessment yielded a result. The patient got a treatment. Actually, the patient received the treatment. So you need to pay attention to these small details. And if you're not expert enough, you need to get help from the right people to handle this. Please do not use abbreviations of verbal expressions that didn't, can't, were not. You have to write them in full. Never start a sentence with a number. Spell it in words. 15 patient, rather than 15 patient numbers. 27 days. If you don't want to start with numbers, then you can modify the wording. A total of 15 patients after 27 days. Whenever I read papers, I see a lot of sentences without a verb. So never, ever write a sentence without a verb. I can give you an example I have seen. Currently, 2 sets of criteria to diagnose SOSVD coexist and are used in clinical practice. What do you think? There's something missing there. The Seattle criteria introduced by McDonald et al. In 1984 and the Baltimore criteria by Jones et al. In 1987. So you can see that this first sentence, currently 2 sets of criteria to diagnose SOSVD coexist and are used in clinical practice. There's something missing there. And actually, you have to fix it. 2 sets of criteria coexist and are used in clinical practice. The Seattle criteria introduced, etc. So these are important issues. Don't use capital letters unless they are grammatically needed. Usually, we use a capital letter only at the first letter of the first word on a sentence for a person's names or for proprietary names. So avoid capitalizing each word of a title or heading or subheading. Do not use capitals for individual words of a compound. I personally, especially in a story, in a nicer flow, would avoid using too many paragraphs. Statements on the same or similar topic should be all under the same single paragraph. Some subtle issues about the English language. Adjectives have no plural. So you should say hospital beds, not hospitals beds. Again, you may seek some help from native English speakers. And of course, you have to always remember, my friends, that editors and reviewers are busy people just like you. So you have to make things easy to save time. And that will help to avoid their bad disposition towards your paper. So, in conclusion, I hope I have convinced you that you have to write your paper in the most possibly concise way Unnecessary repetition is boring. Avoid wasting writing space with lengthy descriptions of data which do not add relevant information. Do not invite criticism from the reviewer by including data which do not make sense and cannot be logically discussed or explained. And remember that no matter how good your work and data are, they will never see the light. They are not legibly described and discussed. So again, I do insist, always proofread your document before passing it to the next one in line, be it a co-author or a journal editor. And of course, I say good luck with your applications. All what I have discussed with you in the last 40 minutes or so is summarized in this paper that we have published in Clinical Hematology International, which is the official peer review open access academic journal of the International Academy for Clinical Hematology. So you can access it. You have this QR code, and we do encourage you, of course, to submit your work, your reviews, your papers to the ICH journal. It's an academic open access. We don't charge submission fees. We don't charge any publication fees. So with this, I'd like to thank you for your attention, and we'll take a few questions. And I see you already submitted a lot of questions, so thank you. So I have a question is about if I submit a paper and a reviewer asks me to cite one of their papers, although the paper was not related to my manuscript, how to deal with such situation? Well, sometimes it happens indeed. And in that case, actually, you have simply to reply politely and explain why you're not including it, because it is not relevant. In general, well, there is always some connection, so you may wish to try to find it to keep the reviewer in a good mood, but if it is totally unlinked, then you simply explain it politely. And don't worry, you know, the editor, the associate editor, the editor-in-chief will also take it into account. You can appeal to their fair hearing. Is there a limit of number of references when writing an original manuscript or review article? Well, it depends on the journal. So this is why you have to read the instructions to authors. Is there a recommended number of words or pages in a review article? My answer is the same. Well, you have to check the instructions to authors. Dr. Kano is asking whether we charge publication fees in the ICH journal. The answer is no. It's an academic open access. It is referenced on PubMed, Clinical Hematology International, so you can submit without any problem. Obviously, this will go through peer review. We have another question about the use of artificial intelligence in helping with language and grammar corrections only. Is it allowed? Short answer is yes, of course. However, please be careful about using artificial intelligence. If you think that artificial intelligence is going to write your paper, I don't think it will make it. At least I'm not aware of great papers that were generated by AI and went into high impact factor journals. But of course, you can use AI for grammar corrections, for language, for searching a given topic. But I think you need to be transparent and honest about it. And although this is not historically, it hasn't been the case, well, be transparent and disclose it in your methods, in your methodology. Although I must confess that this field about the use of artificial intelligence is not yet well regulated, and not all journals have a specific or well-defined policy about this. We have a question here whether you advise to state the name of reviewers who should not be contacted when something. Yes, this is about the reviewers you would like to exclude because you believe you have they have a conflict of interest. They don't like you. You have a dispute. In general, unless there's something very weird, the editors will follow your request. And usually, as an editor, I try to avoid the reviewers that were excluded by the authors. So, on the other hand, you can recommend reviewers. However, the editors may not always follow your recommendation. I personally, as an editor, would always pick one of the one of the reviewers recommended by the authors, and then choose another one who wasn't recommended, and then figure it out. But again, as I mentioned in my talk, recommending a reviewer doesn't give you a guarantee for acceptance, at least statistically in my experience. So it's 47 minutes past the hour. I hope that you have enjoyed this special webinar dedicated to how to get published. This is part of a new series launched by the ICH dedicated to communication and academic scientific activities. So this is the International Academy for Clinical Hematology around the globe and across the hematology field. Wherever you are, please stay safe and keep well. Thank you very much.